the audience for questions. You want to go first, Bonita?
Wow. All I can say is wow. I'm glad I was working at Cook County Hospital. I knew about the strike.
A little louder.
I knew about the strike. In '75, I was having a baby at University of Illinois Hospital. But it makes me really proud to be an ex-county employee and to know that the doctors galvanized to walk through those long hallways for the people that would come in. And this film, I knew a lot, but I know a lot more from the film. I learned some new things about union and organizing, and I'm proud to have been a Cook County worker. I've worked in different healthcare settings. I worked at Illinois Masonic, which is a non-union shop, and I worked at County, which is a union shop, and St. Bernard's a union shop, and it's a vastly total different organization altogether. Your raises and everything at Illinois Masonic are dependent on if your manager or your supervisor likes you. If they don't, you don't get anything. If they do, you get a lot. I work in behavioral health. I've been there almost 20 years, and I see a lot of people coming into the hospital. It's like a revolving door. Some of them have insurance and some of them don't. St. Bernard is like a mini Cook County Hospital, because if you come into our ER, we don't turn anyone away. We see everybody that comes through that door with insurance or without insurance. And we have a lot of patients that come in, get medicated, get well, go back on the streets, but because there are no support services in mental health now, because the governor has shut down all the facilities, it's really sad because people are getting worse and worse, and there's no place to go. And it impacts the hospital, which is small safety net hospitals, because we don't know if our doors are going to be open today or tomorrow because of the budget, and we still have to keep things up and running. We don't know if we're going to get a raise or not, but most of the people that come to work at the hospital come because they want to. They don't care about the raise. They care about the patients that come through our doors. And we see our patients come in, they don't have jobs, and it makes it worse for everybody. So it's really hard to see, being in the community, being in the ER. I don't watch the news because I'm in the ER. I see it before it gets on the TV. So I tell people, I won't turn it on. But it's sad because these people, white, blacks, and Hispanics of any color that are hardworking, poor people, don't have jobs. They have nobody to go to. And when they go to their community figures, they say, well, we're going to do this and we're going to do that, but they don't. There are no jobs in our communities. And if we had jobs, our communities could do better. So basically, that's all I have to say. The movie was wow. I learned a lot of stuff from the movie. I really did. So I'm proud to have been at County for 14 years. It really makes me feel good.
Well, thanks everybody for coming. I really want to thank SEIU, who I think everybody in this room knows has been instrumental, not just in terms of organizing healthcare workers, but public sector workers throughout the country. Particularly over the last 40 to 50 years, and certainly Michael and his team for bringing these films together. Anybody not know the Chicago Teachers Union now has authorized a strike vote? So since everybody knows, I'm inviting you to be back here at 6 o'clock tomorrow, because we're going to have another meeting of the Strike Support Committee. So bring a friend, do whatever you can. If you can't come, let myself and other people know, and we'll put you on the email list if you want. There's a lot of different ways you can help out, both if the strike doesn't happen or if it does. I hope everybody here, really takes seriously what were in the films, but particularly the second film. I don't know if it's publicly available to show, but if it is, I think it's a great film to show. This was 1970. It was a huge period, right? Union organizing in the public sector was a direct result of the Civil Rights Movement. As African Americans successfully, along with Latinos, fought to get into the public sector since before World War II, but the Civil Rights Movement really had to take off. But getting a job in the public sector didn't mean you were in the union. So people had to push AFSCME, SEIU, and other unions in the public sector to get organized. And almost at the same time the strike was going on, in the same year in 1970, was the largest wildcat strike in U.S. history. That was led by African-American postal workers who had to go up against not just the Postmaster General in the U.S. Congress, but had to go up against their union leadership, who was all white and didn't think that they needed to go on strike, and they had a lot of good reasons for doing that. So I think there's a lot of good lessons to learn from both these films, but I think the difference between the two films and what happened during the strike and afterwards is based on everything else in life. Class, race, gender, and geography, at least. You can see what people were willing to do in the HSA, which I think was, for doctors, a huge step forward. But honestly, being part of that, it was nothing when you look at what people were willing to sacrifice in Charleston. One strike lasted 100 days, the other one lasted 18 days. I think one thing, does anybody here have any old videos they've taken at home? From an old camera, on your computer, or anything else? Anybody have any? Raise your hand. So here's one really good lesson. Don't get rid of those videos and don't let anybody edit them if you're not sitting there. So nobody directly involved in the strike, and Judy Hoffman was not there when hours and hours of video were cut down to this, what is it, 21 minutes?
21 minutes.
Is that what it is? I think there were good things in this film for the HSA, but there were many better things that were left out. For example, the kind of speech that Andrew Young gave in the Charleston thing, we had 3 or 4 of those speeches in the original film, none of them which made it into this cut. So I don't know why that happened. I don't even know who the person was that did the editing, but neither Judy or any of us who were involved in the strike were there, and all that other film was lost. Judy didn't know what happened to it, just kind of Partemkin, I guess, just kind of threw it out, or the other person did. So don't hold on to those videos. I want to talk about some of the issues that were in the strike, but the main lessons, I think, are, for not just the CTU, but for all of us, is like, well, what do you do to prepare, not just for a strike, but what do you do to organize? So in 1974, when I started a residency program in family medicine at Cook County Hospital, under Dr. Prieto, who was featured in the movie, basically the union had already been formed. That happened a year before. Unfortunately, some of the hospital administrators and some of the chairs of the department, who I will not name, basically both fired the residents who were responsible for successfully organizing the union and blackballed other ones, so that it became very difficult for them to get jobs anywhere in the country. That didn't stop the HSA, though. The change that happened in '74 was that '74 was really the first year where you had significant affirmative action that had occurred in medical schools. UIC, which was then the University of Illinois, was basically the biggest medical school in the country. It depends on the year now whether it's Indiana or UIC still. And 275 students were in each class, and that was, in my class of 1970 at UIC, that was the first class that had significant numbers of African Americans, Latinos, and other people of color. One of the things in the movie, besides cutting out, I think, some of the most progressive speeches and organizing, there were no physicians of color shown in the movie, even though there were lots of interviews with them. So again, I don't know what happened. So what did we do to prepare for the strike? 4 of us, including Arthur Hoffman, who had the big beard in the movie, we volunteered, because nobody else wanted to write the contract. And so the first thing we did is we had a great relationship with the House Staff Office, and we asked them to help us create an on-paper database of all 650 physicians. That didn't happen overnight. And then we identified who was from Cook County or Chicago, who actually grew up at least part of their life in Cook County and Chicago. And then we actually went to them individually and asked them, would they be willing to go back to their schools or churches or any place else in their community and talk to people about what people wanted us to put in the contract. There were about 75 physicians who actually grew up in either Chicago or Cook County out of the 650 who were willing to do that. Some of us who had been trained in community union organizing before that, sat down with them one-on-one, went through some basic training, and they took it from there, and it was really successful. So what we wrote in the contract was not things primarily coming out of our heads. I mean, we had a lot of ideas. Those of you who were in the old county hospital, I don't know, anybody there before 75 or 76? So there were wards of 50, up to 50 or 60 patients with nothing in between the patients. There were no curtains, there were no dividers, there were no walls. All that came after the strike. So first came the curtains. That was, you know, people may think that's a small victory. That was a huge thing compared to 19th century conditions, you know, before the hospital. Then we of course, talked to the hospital staff. You saw the largest number of people in this film who were actually hospital staff from Cook County were housekeepers, because the housekeepers are the most militant group of workers in the hospital at that point, along with some of the nurses. The hospital belonged to what's now SEIU, I think Local 73. Is that Local 73 under SEIU now?
Yeah.
Yeah. So at that point, I don't think it was. I think it was under the Teamsters, which was very difficult for them to organize because the Teamsters were both racist and didn't care about housekeepers. But they did it anyway. And so there were actually 5 people just in this 21-minute cut who were housekeepers. They played a crucial role because the sanitation conditions, if you read David Ansell's book, that was just literally the tip of the cockroach. And it wasn't people's fault. So one of the gains we got was actually we got some more housekeepers. And the other staffing and equipment that was really crucial here. 3 women had died of preventable deaths in the 6 months before the strike on the 5th floor. Now remember, this is 1975. Hospitals did not take Medicaid, and most women didn't have Medicaid when they were pregnant. It was just coming into vogue. It wasn't really in effect. So we had up to 75 to 90 deliveries a day at Cook County Hospital. Nothing compared to what it is now. I mean, it's just, it was overwhelming. So we did get some more nurses, we got emergency equipment, and there were several other small things which weren't small to some of us, but I think the person at the end of the movie really underplayed those gains. I guess I'd like to say, and I think we'll save most of it for question and answer, is what are the lessons now? I think one key lesson that not just happened in this strike, but happened more and more up to the Janitors for Justice strikes in Houston and Los Angeles under SEIU, was that you can't just do organizing at the workplace. Okay. Those of you who are familiar with Janitors for Justice strikes in the end of the 90s know that there's maybe a couple or 3 or 4 housekeepers in a huge building, and so you can't just try to organize at the workplace. So what did they do? They basically went out to their communities, they went to their blocks, they went to their churches, they went to their schools, some of which happened in the Charleston strike. So I think that's a really key thing to do. The coalition's got to be built with the other workers, and particularly if there's unions at the workplace. We started that a year before the strike. It was definitely helped the strike go on for 18 days. We had tremendous support. Most of those workers who you saw in that film urged us to continue after 18 days. If we would have gone on 2 or 3 more days, we would have won a lot more. So that's, I think, another key lesson. And lastly, I just want to briefly mention the fact of where we're at right now with the public sector, but particularly public health. There was a report issued in December 2015 by both the American Public Health Association, Department of Health and Human Services, said by 2020, about 4 years from now, we need 250,000, a 250,000 public health workers. How many do you think we have now? I know Dr. Murray knows. My colleague over here. We have 110,000 public health workers. We've lost 85,000 in the last 30 years. So we have almost no infrastructure left outside of brick and mortar facilities. You could see that in the response to both the 2009 swine flu pandemic, and certainly last year in terms of Ebola. We really dodged a bullet in both cases. So going on the offensive to expand the public sector, whether it's in education, whether it's bus and train drivers who are fighting for a contract here in Chicago under ATU, or certainly the teachers union, is the way we have to go, including looking at in the next 3 to 5 years general strikes in every city in the United States. So thank you very much.
I guess the thing that I would say, which concerns me, is that if the number of people who are organized or members of the organized unions has gone down in this country. The percentage of workers who are organized in unions has gone down. And the ability to mobilize people in a strike such as you had in South Carolina, or even a house staff association, I think I find it's difficult today You know, if I look at the house staff today and look at the house staff then, you know, the majority of, you know, and these docs were primarily from the Department of Medicine and Family Medicine. And today, those are predominantly foreign medical grads who are timid, worried about their immigration status, and would probably be too afraid to mount an effective strike. It's distressing to me that some of the same things that they were arguing about then, we still fight about. I mean, in terms of access to care. I mean, make no mistake about it, we've made progress in terms of material things, in terms of, you know, the hospital, in terms of facilities. But there's some basic principles that we still have to fight for on a daily basis. And so it's distressing to me that we have not secured those things, you know. But the reality is that the battle is never won. You know, whenever you win something against a battle against oppression, there are always those forces lurking in the corners, ready to reemerge and put things back down again. So if you're talking about the status of mental health in our country today, in our society today, it's not just Rauner, you know, who is the problem with, because before Rauner came into office, we were closing down the city mental health, the community mental health centers. So it's a societal problem that we don't accept the need for that service. You know, we would rather turn our heads, close our eyes, or look the other way and pretend it's not a problem and not a reality. And yet we have fewer resources today to battle those things. In other words, what are our ability to mobilize people? The teachers union had a period where they were fairly successful at strikes, and then they didn't strike for a long time, and then they had their strike in 2012. So they're reemerging, but that is, you know, the power of unions, the power of people to form coalitions and fight for issues of social justice is a very important thing that we have lost in the society, because there are less people who are willing to go out and do those things, and that's problematic. And I think that we are under attack from a lot of, you know, conservatives, you know, with this, what's happening on the local level and on the national level. If you look at the city government, the county government, the state government, and some of the decisions that are made and where our resources are going in the future, it's distressing. And I think this is an important conversation or dialogue to have. I think the lessons that Howard, you're talking about lessons learned in terms of coalitions. We've always known that coalitions are key, are important. But the important coalition was the House Staff Association, was that you had doctors who usually are not, I refer to as being politically inert, who were willing to put a lot on the line, their careers, their jobs, because for many people it was very difficult to get employment after that event. And they were unifying with, you know, the environmental services workers, acknowledging that they had a common goal. There was something that they had that they had in common. And that's the same thing that made the strike in Charleston successful, was that it was the community coming together, people realizing that it didn't matter if you were just that it affected everyone. It wasn't just if you were a hotel worker, that it was the community. So I think that's an important discussion, that a thread that came through both films. And I don't know if you have noted more of that, but you know, the fact that you had everyone involved, not just, and you know, whether the attendings were not full-time attendings, the majority of them in county back at that time, if I'm not mistaken. Were they?
Well, it was a mixed bag. Some were, some weren't.
Yeah.
Yeah, I think just the last point that Dr. Fegan's, you know, referring to is that county, you know, was fair game to be divided up so that each department was affiliated with a different medical school. There was not one unified affiliation, which I hear is starting to happen again. I don't know, you can help me understand that later. So what that meant is that some of the attendings were full-time county employees, and a lot of the part-time attendings were coming from different medical schools, all of the medical schools, and that was a real problem. The reason that the strike would have been a lot more successful if we would have stayed out 2 or 3 more days. By the way, there was a 9-7 vote on the strike committee. I was on the 7 side, I lost. And is because the attendings were absolutely exhausted, which is understandable. One of the things is we worked an average of 80 to 100 hours a week. I don't mean just the surgeons. I mean those of us who were in internal medicine, family medicine, pediatrics. And so that was one of our demands. It was one of the few demands we had for the doctors, is to work 60 hours a week. We didn't get that concretely. We did get a little bit of decrease after that. But I think what Claudia said earlier is really key. The reason that basically the system of capitalism is going after public everybody is because 35% of all public workers are still in unions versus 7% of the private sector. In January of 2015 was the first time in U.S. history that the actual quantitative number of unionized public workers surpassed that of private workers. Now that doesn't mean that there's any increase going on in public unions. What it means is there's a tremendous decrease in the private sector. But that has a lot to do with how, if you want to increase your profits and surplus value, which is the goal of capitalism, whether you think it's a good system or not, well, what you got to do is get the obstacles out of the way, and the number one obstacle is the unions. And I think that the CTU and the victories they've helped do in Seattle, Los Angeles, and other cities since the strike has been really key to fighting back against that.
I just wanted to ask, Bonita, you were talking kind of in general about this erosion of the public health structure. You've seen that on the ground, what that's like working in crisis care. Can you talk a little bit about what that looks like just every day for you, like how things change?
Every day for me, my patients come in, it's like I'm ground zero for behavioral health patients. And I come in and I have to deal with the patient and the nucleus of the family, because a lot of families bring the patients in because they don't know what to do with them. You know, they're acting out at home or they're not taking the medication. And then when I look for resource services for them to go to once they leave our facility, there's not much out there for me to grab a hold to and say, look, you can take your son here to this day program, and with this day program, they'll teach them certain skills on how to take their medication and how to react to certain reactions that set them off. We have a PHC program, and it's fairly new, and I think we might have 12 patients in it, but we have to screen them because these are patients that have to be self-motivated. They have to take the medication. They have to do their own ADLs, but they also have to have the support of the family bringing them and dropping them off. And a lot of times we don't get that because we have patients with dual diagnosis. They have psychotic induced for drugs and alcohol, and then they're taking the regular drug. They're taking Seroquel and they lithium, or they come in, and it's just a big vicious circle going around and around and around, and it's really no place to send them. So, but we can't turn them away. We get patients that come in, and we know, I have a patient I know that's not having a psychotic break, but he's having a drug-induced break, but I can't turn him away. I have to take care of him. I can't send him back out on the streets. And it's hard at St. Bernard because with me being a steward, I talk to the members all the time, but we have to hit the streets. We have to get everybody out to vote. The biggest issue we had this last election was nobody wanted to go out and vote. Everybody said, well, I'm okay. I voted for Obama. Obama's going to be okay. But you have to live after Obamacare. You have to live after Obama's out of office. So we got Romney in. He cut a lot of the programs, a lot of the the strides that we made as far as mental health, getting different things put in place will cut down near to none, so it's like our hands are tied.
Yeah.
I just want to mention a couple of things that are going on. As hard as it is, that the Chicago mental health movement continues to fight to keep the 6 clinics, the 6 public clinics that we have, and to reopen the 6 that were closed. And at one time there were 21.
Right.
They keep fighting back against that and keep fighting to improve the services in the clinics that exist, because there's no clinic that has full-time psychiatrists.
Right.
A lot of the programs have been cut. And although that's mainly, most of the organizing is being done by clients of the clinics, AFSCME is involved and is helping with that, I'm glad to say. And the other group that's organizing, I think, across a really difficult coalition is the Alliance for Community Services, which organizes state workers in the public services offices and the clients of those workers. And just recently, I think 12 sites across the state had joint actions by clients and AFSCME workers around the Governor Rauner's threat not to request a waiver to get food stamps for some more than 250,000 people who, thanks to the Clinton welfare reform, can't get food stamps except 3 months out of every 36 unless the state requests a waiver. So those are a couple of things, and those are all really, really, really hard to work on, but people are doing it. And the disability rights movement organizing with SEIU around disability services and overtime policies that meet the needs of workers and clients when the governor would like to not pay anybody overtime and threaten that they either have to choose that or they lose their health care. They can either work overtime or they can lose their health care. I mean, people are really working in really difficult situations and not giving up.
Yeah, I think the problem here is not just, you look at a state that is, we're morally bankrupt and we're financially bankrupt. And that the reality is that by not having a budget, there are all kinds of social services that are just melting away because people cannot wait indefinitely to get funding. And some of these things that we're losing, one of the hallmarks of the loss of Lutheran services is that, we aren't going to get those back. I mean, just if they were suddenly to pass a budget, we aren't going to get back some of the things that we're losing. And I think we were talking just before the film about the fact that, in 1955, there were like 35,000 inpatient mental health beds in the state of Illinois. And now they're like less than 5,000. Now, we probably don't need the 35,000 because we were warehousing people in really depraved conditions, but we need more than what we have now. And so, and when you take away all of those inpatient beds and you don't provide outpatient facilities, places for people to go, these are certainly patients who could be managed if they had regular access to care. That's how we wind up with a situation with a third of the detainees at CIRMAC. And I remind people that the thing that most of the people at CIRMAC are guilty of is not being able to make bail. So that becomes, by default, our mental institutions where people who wind up who can't get their medications or who have chaotic lives and can't stay on their medications, they wind up being detained. No one gets arrested 120 times for trespassing because they're, stupid. It's because they have a problem and we don't have the resources and we aren't providing them with access to the resources they need. So, that's a much bigger issue, a societal issue, a failure to take ownership of the needs of providing for members of our society who need a little bit more support. And without folks organized in their efforts to deal with it, the mentally ill are not good advocates for the services they need. But if we as a society don't begin to advocate for that, we fail that segment of society, and as a society we fail. And I think that I always tell physicians, no one cares about physicians complaining about their wages. But when physicians advocate on behalf of their patients, then society will join them. and they have such an opportunity to speak out because they see firsthand, and they can be better stewards of the patients they serve.
So everybody here is here and not listening to that horrible debate. I was glad we were having.
We're watching it back there.
Thank you. Don't bring it in here.
But, which leads me to my question. So, certainly, around the country, when I moved around the country and talked to active locals and labor leaders, you know, they say that the majority of their members are supporting Trump in some of these, locals. And so, the Trump phenomenon, that is to say, the people who are supporting Trump, the Trump phenomenon is not new, but the level of support that he's getting by this race baiting and fear mongering represents something. So my question is, how do you take the spirit of these movements? These are only two examples of so many around social justice. Even in bad times, we still have many things we don't hear about on the news. How do we take that organizing and understanding what's going wrong and convince the rest of these folks that are, he's going to get 40%. I don't know who's going to win, but he's not going to get 10% of the vote.
No, it's not.
He's going to get a lot of the vote. And so the question really is, how can we take those concerns, which are based in some reality? Their diagnosis of the cause, I think, is wrong, but the notion that they're in pain is not wrong. So how do we take that population and talk to them in a way that they can understand? Anybody, I don't mean
Yeah.
Anybody can answer that. If you have an answer, I don't know.
Well, I don't have an answer, but I do know an organizer with SEIU who is a Republican, pro-union, pro-Bernie Sanders, pro-single-payer healthcare, who's going out and organizing against Ronner in areas like around Marseilles and that part of the state. I and some other people from the Alliance for Community Services went out with him one day. So I know there are people doing it, and if I come across somebody like that, I will do what I can to help them.
I would just suggest something. I work here at SEIU Healthcare, and I would say, this is my personal opinion though, to be clear. I would say that one way of doing it is opening dialogue about the areas of commonality. I mean, people who support Trump, they're feeling the pain like so many other people are, and their solutions, I think, are flawed, but we've got something in common, and I think that so much of the discourse is so divisive. Like, I can't believe you're stupid enough to,
Right.
Yeah, that never wins the argument, right?
No, I mean,
That's a problem.
I think taking a deep breath and like meeting somebody where they are and know that, from their worldview, this makes perfect sense, and maybe there's something that we're thinking that doesn't make, and meet them in whatever middle we can find to talk. I don't know.
Yeah, I think the challenge is that people believe that Hillary represents more of the same, and that's created their pain, and so they're thinking, how bad could it be? Without really having a recognition, it could be really bad.
So I'm sorry.
Yeah, no, go ahead.
So I guess one statistic of all the statistics, and I don't keep up with most of them in terms of electoral politics, is that the only group of people who supported Sanders who are having a significant percentage, not close to the majority, but a significant percentage, who will now say they're going to support Trump, are white males between 35 and 55. So what Trump does is similar to what Hitler did in the 20s. Okay, Trump's a populist. We can debate whether he's a neo-fascist or a fascist, but for sure he's a populist, and he speaks directly to the perceived and real pain, that group is feeling, right? So that group, by no coincidence, has had the highest suicide rate in the United States since 2008. Okay, significantly higher than any group. Because for them, and this is real, right? The game's over, okay? The system is no longer going to give them white skin privilege, which they don't recognize as white skin privilege. It's not going to give them all the benefits of every generation that preceded them that they knew. And we know that that's true. Here at UIC, there was an academic in the late 90s, I can't remember her name right now, and I think she's still on campus. She was the first one who really showed that generation, this is a lot of our kids, was going to be the first generation that made less money and had less economic security than the previous generation in the history of the United States, at least in statistics were being kept. Okay. She's also the one, by the way, who said that of doctors. She proved that with doctors in 1998. So I think the problem is that if we think we're going to solve this problem by relying on the Democratic Party, well, the game's over. Okay, the game's over. And I don't want to get into the debate about whether to vote for Hillary or not, although I'd be happy to talk to people about that afterwards. But I think the fact of the matter is that's where we're at. You know, that's where we're at right now. It's a crucial moment. Now, there's a lot of good people who think you can reform the Democratic Party, right? So that's Bernie Sanders, in quotes, revolution. They're working with the National Nurses United and other groups to reform the Democratic Party. All power to you, that's all I gotta say. Then there's other people who think that's impossible, which is the group I'm with. Not necessarily that hot on Jill Stein, but there's a lot of other people who were in the Sanders campaign or who weren't in the campaign. And I think the problem we have is that in the United States, 17% of the people are registered Democrats, 13% are registered Republicans, 45% are independents, and the other 25 or 30, whatever that adds up to, don't vote, okay? And larger numbers don't vote. So there's nobody out there that's basically getting people excited about voting, and particularly in this election. So we've got to figure out a new way to do things. And if we don't, you know, the right's going to win. I think we've got a lot of elements of fascism already, including why Black Lives Matter, Black Youth Project 100 exists, the groups against Islamophobia. Those are all the results of fascism as far as I'm concerned. But if we don't figure our way out of this by doing something different, then game's over. You know, the last 5 years Howard Zinn was alive, he said over and over again with increasing frequency, and Amy Goodman, the first time he told her this, her mouth dropped open. He said, well, the first thing you got to do is lose faith. And Amy Goodman said, what do you mean lose faith? He says, yeah, the first thing we have to do is lose faith in the Democratic Party. If we don't do that, nothing's going to get better.
Do we have time for maybe one more question or comment?
I'll just say something really quickly. What you were talking about too, about like white males between 35 and 55, one of the things that they're seeing is lack of unionization, because I mean, unions were so white, and all the stories that a lot of prominent stories we see about unionization are white. And part of the aim of this series is really to sort of balance that record out, as you saw people of color and women or women of color like organizing. But I feel like it just seems to me like, yeah, when you see the story of like peak unionization, which was like in '53 or something, like it's very white, and a lot of that loss, paradoxically, is because of the Democratic Party and so white privilege is kind of embedded in loss of like feeling empowered in the workplace. It's just one of the wrinkles that I saw in that. It's not really a question. Sorry.
Oh, no, I think that's key, but it's tied to deindustrialization, right?
Right.
But of course, the
Right,
people,
lack
who
of
lost,
manufacturing,
the people
yeah.
who lost the most in deindustrialization were African American and Latino workers. But white workers feel that they lost everything.
Right.
I think there's somebody in the back.
Yeah.
Well, to continue on this line, one of the problems that I've faced all these years in voting, someone else other than me called it voting for the evil of two lessers.
Right.
But it's always taken us away from building another party. A Labor Party makes the most sense to me. There was an attempt at it in the 90s, maybe. Nothing much happened of it. I'm wondering, we're all labor, or you guys are labor people. What do you think of the possibilities of that? We're not going to have, either way, we're not going to have our people in office this time. That gives us a chance to work for 8 years at getting something for the next time around. I agree with you on the idea that reforming the Democratic Party is not going to work. We need at least one more, if not many parties.
Right, so having spent a significant portion of my career advocating for specifically single payer, but universal health care as just like a beginning, and no country, and every other industrialized country has managed to do this, no country has ever gotten to universal health care without the support of labor. either a strong labor party or a strong labor movement. And labor is currently floundering in this country. That's one of my opening remarks, is that we're in trouble because labor is in trouble in this country. So working people don't really have a voice. And for a significant, for the parties, why you have labor people talking about going for Trump is because they see the big bosses as being big bosses, even in the unions, and therefore not necessarily representing their constituency. And I remember having this discussion in the 90s with some of the executives of the auto workers union about they weren't in favor of single payer because they were worried about what was going to happen with some of the funds that they have set aside for workers. And it's when you started having members of the union sitting on the hospital boards, then they were no longer representing their constituency. And so really making a voice for labor, having a voice for those people who are disenfranchised by the current system is where we have failed. We haven't seized that opportunity. Regardless of the party in power, it represents an opportunity for people to realize that there could be another party that would have a voice for those who are unspoken or unrepresented. And we just haven't hit upon the right coalition to make that happen.
I mean, I don't want people to go away here like feeling more depressed than maybe when you came here. So I think we need to talk, wait till you watch the debate. But I think the good news is that a lot of labor is moving in a better direction, okay? Meaning that in the last 5 years, we've had major victories, not just locally with the CTU and then their partners in Seattle and LA and other cities, which is beginning to change the AFT, which needs a lot of change, the American Federation of Teachers, and the NEA to a lesser extent. But we've had a left populist takeover first of the Amalgamated Transit Union Workers 5 years ago. Then we had basically the formation of the National Nurses United, which came out of originally the Bay Area, by certainly more than left populist people. And then Mark Dimmenstein and his entire slate won the election of the American Postal Workers Union, which as a single entity representing a single group of workers is the largest public union in the country at 300,000. And this has been very positive. And I think what I would say about a labor party, it's too late for just a labor party. What we have to do is have a much more de-siloed party, or organization. But number one, there has to be a lot of more support to mass movements that exist in the United States, which I don't consider labor being a mass movement. I consider Black Lives Matter, the Dreamers who are fighting for immigration, justice, the transgender, movement, the movement certainly against Islamophobia, and in this place, certainly the Fight for 15 movement. I think that's what has to happen, is that those movements that truly exist now have got to be given more support in terms of solidarity and mutual aid, not because we're feeling sorry for them, but that's, I think, how we're going to build something. Now, unions are supporting a number of those, right? And so I think there's got to be certainly at least one other party formed, but it's got to come out of mass movements, and it can't just be a labor party.
Well, there's another way to define labor as worker, and so maybe we're not talking about a union party, we're talking about a worker party,
Well, the
which
problem with that
involves
is what's the
unemployed as well as employed, which involves the Fight for 15.
Right.
And it involves all of the direction that I think we agree on that labor is going.
Yeah, but a couple miles south of here in Englewood, the unemployment rate is close to 50%. So we can't just talk about a worker, whether it's the union or non-union workers. It's got to be broader than that. It's one of the big problems. This happened in the 30s and it was never resolved. Is the question of labor and race. It's never been resolved. And to think we're going to just do things on the basis of workers, no, that's not how we're going to be doing things. It's got to be on the basis of racial justice and all the other movements I mentioned. So yeah, unions should be involved, labor should be involved, but it can't just be a worker thing. I have these discussions with Trotskyists like every other week, You know, that's all they think about are workers.
Workers.
I was in France for the climate change talks in December, okay? And I got invited to a huge event, 500 people. And I didn't understand all of the conversation, but I understood most of it, and I had a translator for the rest. They went the whole evening. They gave an hour and a half speeches without talking about immigrants from Africa and Muslim immigrants in Paris and France. They went an hour and a half and just talked about workers. That's not going to cut it. That's it never cut it, and for sure with the weakness in the labor union, it's not cutting it now. If they don't deal with the question of race, you know, and basically realize it's not just a worker, you know, then we're not going to get anywhere.